This time last month, Canada's daily caseload stood at a little over 2,300. The latest total is 14 times that, and the highest during this pandemic. For his take on these growing numbers and the response to them by governments across Canada, let's bring in Andre Picard now. He's a health columnist with the Globe and Mail who has written an article entitled, "Now is not the time to give in to Omicron despair." He joins me from Vancouver this morning. Great to see you, Andre.
Good morning.
You say in your article, most of us will get COVID, even the most diligent. So given that, how do people, especially those who feel as though they've done everything right over the last 2 years, not feel a sort of resignation over all of this?
Yeah, I think what you have to realize is what you've done is not for naught. It's been very helpful. Vaccination especially means that cases will be much more mild. You're going to prevent the further spread to other people at a time where the spread is quite astronomical. So all the things you've done have been useful. We have better treatments now. We know better public health measures, what works, what doesn't. We're used to living with masks, etc. So there's a lot of good, a lot of things we've learned in the last couple of years, and we shouldn't forget that when we see the numbers exploding. Those are part of the story, but they're a very small part of the story.
You mentioned that there is no shame in catching COVID. In fact, your line is, catching a respiratory virus is not a moral failing. But it's tough, isn't it, when friends or colleagues might be grilling you about how you got it, where you got it?
Yeah, it is tough. I've talked to a lot of people who say, I feel really bad. I thought I'd done everything right and I've got it anyhow. And that's not a problem. That's not your problem. That's the virus adapting. We expected that. We didn't know it would be as good as Omicron at adapting. But the things you've done are not wasted. I think that message is really important, and you shouldn't feel bad. You should continue to do what you can to minimize harm without, sinking into despair or giving up.
You're right that when you've had 2 shots and you still get sick, it feels almost like a betrayal. What's the best way to avoid dipping into despair then, in your opinion?
Yeah, I think it does feel like a betrayal. I did this. I thought 2 shots would do. And now we're learning that the virus is a little more wily than we expected. We're going to need the 3rd shot. Maybe we'll need annual shots. We don't know yet. But that's just adapting to the reality of the virus. It's almost like a new virus now. It's so different. So we have to say, listen, let's keep doing the right thing. And again, I have to emphasize what we've done in the past is not useless. It's really delayed. It could have been much, much worse. Imagine if it was Omicron in March 2020, it would have been a gigantic disaster. We would have had 10, 20 times more deaths. So we have to just look at some of the bright side of this, that we're much better prepared.
As you know, Andre, provinces like Manitoba are now implementing 4th doses, especially for immunocompromised populations. For example, if you're undergoing chemotherapy. Given that trend, which we may see in other jurisdictions, we're certainly seeing other places around the world, do you worry that might deter the vaccine hesitant from jumping on board, saying, you see, they don't last long anyway?
I think there's a small percentage of people who think that, people who've thought, you lied to me. I thought it was going to be 1 dose, then I thought 2, etc. But we just have to shift. I think the reality is it seems to be a 3-dose vaccine. And then in some cases, as with many vaccines, people who are immunocompromised, who have special issues, need additional help because they have weakened immune systems. So I think it's important to understand none of this is new in the vaccination world, but it's new because Omicron, because of COVID, is on such a large scale. But 3-dose vaccines are pretty normal. Boosters after sometimes a year, annual flu shots, or after a few years like tetanus. Again, these are normal things in the vaccine world.
Final question, Andre. You have written so extensively about this in the last couple of years. I wonder, what drove you to write this particular article? Why did you feel you needed to deliver a message? It seems as though it's sort of a hang-in-there message to Canadians.
I just heard a lot of people feeling kind of hopeless, people who've been doing all the right things, who've been following the news very closely. And I don't think it's a time to be hopeless. I think quite on the contrary, I think there's a lot of hope. A lot of us are building up immunity with fairly mild illness, with good vaccines. So I think it's a time where we really can see the end of the pandemic in sight, it becoming endemic, where we can control it, where we only have to deal with a very small number of very sick people, and the rest of us can get on with our lives. So I think it is it's a bit counterintuitive, but it is a really hopeful time. We can start to see the beginning of the end of this pandemic.
It's important to have a hopeful voice, and we thank you for your time this morning, as always. Thanks, Andre.
Thank you.
Andre Picard, health columnist with the Globe and Mail.